Hi there, this is Jonathan Ginsberg, and I want to talk to you today if your claim for Social Security disability is based on female issues such as endometriosis or menorrhagia, bleeding issues, cramping issues, things like that. And I realize it's not pleasant to talk about, and certainly you don't want to be, you're not looking forward to going to a courtroom and talking about it with a judge and with other people around and so forth, but it can be a disabling condition. And the reason for that is that Social Security defines disability in terms of your reliability at a job. So, for example, you need to be able to, or Social Security needs to be able to show that you'd be able to perform 8 hours a day, 5 days a week at a job. And if you can't do that, then you are disabled. Well, a lot of times if you've got female problems that reoccur every month, basically that would mean that 2 or 3 or 4 days a month you might not be able to come to work, or you might have to take excessive bathroom breaks. Well, if you can document this and your doctor will support you, that 2 or 3 or 4 days a month you would be likely to miss excessive time or miss entire days, then vocational testimony will basically be that you would not be able to sustain competitive employment. So the key there is to get support from your doctors showing that you're likely to miss excessive time from work, reliability issues, and then when we get to a hearing, you testify to that. If there's medical evidence, then I'm going to ask the vocational witness, assume that my client is credible in saying that she's likely to miss 2 days of work a month, and a third and fourth day she might be taking bathroom breaks every 45 minutes or every 2 hours for 15 to 20 minutes. What would that mean in terms of her capacity to work? Vocational witness testimony will be that person could not sustain competitive work, and you win. Now also, Social Security requires that your condition last at least 12 consecutive months or likely to last 12 consecutive months. So it can't be a short-term thing. It's got to be something that's lasted for a year or is likely to last for a year. And finally, realize that Social Security cannot hold it against you if you choose not to have surgery. So for example, if the doctor says, well, there's a surgery here that's likely to help you, but you don't feel comfortable with that surgery, or you have religious reasons not to want to have surgery, they cannot hold it against you. They cannot, Social Security cannot find you that you're not disabled because of your refusal to undergo invasive surgery. So if you've got a condition that has lasted or expected to last 12 consecutive months, and that it keeps you out of work or makes you less reliable for more than 2 or 3 days a month, then you've got a pretty good shot at winning based on some of these female issues. So any questions about this or anything else related to Social Security, please feel free to contact me. Again, this is Jonathan Ginsberg, and I hope this has been helpful to you. Thanks a lot.